Good afternoon. Thanks for joining this special webinar event titled Moving Forward. My name is Kate Carpenter, and I'm the Director of Hospital Services with the Compass HIIN, and I want to thank you all for joining us. Before we get started today, I do want to walk you through just a couple of brief housekeeping items in case you're new to the Zoom platform. We've muted all phone lines upon entry. However, if you'd like to talk, you can use the raise your hand function within the Q&A, and we'll be happy to unmute your line at the end of the session. If you have questions as the session moves on, you can also type those into the chat box where you're typing in your name and roles. You can utilize the chat box throughout the session, and if you're having any technical difficulty with your audio or visual, just type that into the chat and a member of our team will assist you. This session will be recorded and transcribed. A recording of today's session will be posted to Innovation in the coming days and also sent via email to registered attendees. Here's the agenda for today's session. I'm going to be introducing Dr. Evans, who'll be walking us through the history of the HIIN and HIIN programs. We'll be celebrating some of the program results to date and sharing some insights on how we can maintain momentum as we move through the next program transition. He'll be walking us through and sharing some IHC commitments as we move forward to the next scope of work, and finally closing with some commitments and answering any questions you may have as we move forward. With that, I'll welcome Dr. Evans.
Thank you, Kate. It's a pleasure to be with you today. This is a special group for me. We're going to talk a little bit about the history, but thinking back to 2011 when we really kind of started this whole thing, it's amazing to me the journey that the hospitals have made in that time, and I'm just excited to be visiting with you about next steps here today. Just to kind of remind us of who we are and what we're doing here, Compass HIIN is kind of, we're doing business as Compass HIIN, but the Iowa Healthcare Collaborative is kind of the partner who is the sponsoring organization. And of course, we're partnering closely with the South Dakota Association of Healthcare Organizations in exercising this endeavor. We have 147 hospitals in Iowa and South Dakota. And interestingly, excuse me, we have a very high percentage of critical access hospitals and rural hospitals. So I think it's important just to realize that we are kind of a unique rural network, and we're exercising improvement in a particularly challenging environment. The history of the HIIN program, Hospital Engagement Networks, I think is important. Remember, we've had the QIO program around bringing improvement knowledge and content and challenge to the hospital community since the 1980s. But an innovation that CMS introduced with the Affordable Care Act, which was passed in 2010, was this construct where CMS would actually try to work directly with the provider community to do improvement. And the first exercise that they did that was outside of the QIO was the Hospital Engagement Network 1.0. And I remember when we applied for, excuse me, I don't have tuberculosis, I want you to know, it's just this summer cold. But again, sponsored by the Center for Medicare and Medicaid Innovation. This thing was posed in 2011, and I remember getting the news in 2011, in December of 11, that we were successful in beginning that journey. It was a 3-year journey, 2012 through 2014, a very exciting time as hospitals across the entire country came together and said, it's incumbent upon us to raise the standard of care. And hospitals from big systems and small systems and critical access hospitals and whatever came together and decided to help sharpen each other's saws. And we had some remarkable improvement during that 3-year period. CMS was kind of surprised by the progress and said, we ought to try to keep this thing going. So they issued a 1-year extension, which we call HIIN 2.0, and basically to continue the work while CMS tried to figure out, wow, how do we make this thing go forward? And so from 2.0, CMS, matter of fact, what's interesting is the HIIN 1.0 and HIIN 2.0 were both projects within the Center for Medicare and Medicaid Services, the Innovation Center. Remember, CMS, the Centers for Medicare and Medicaid Services, has 7 or 8 centers. The Innovation Center is out there trying to do model tests to see, hey, if we do this cool thing, would it work? And if it does, can we now embed that into CMS proper as the way we do work? What happened is with HIIN 1.0, there was so much success, they extended it in HIIN 2.0, getting ready to bring it from the Innovation Center into CMS proper. The Hospital Improvement and Innovation Network that you are participating in now is not an Innovation Center product. It is a project within CMS proper, and it's been an exciting journey from September of 16, and we're going to be continuing our work through March of next year. And frankly, the progress has continued and accelerated in that journey. So you're a part of something big, and we're really looking forward to the future and moving on to the next thing as well. I think it's time for a little bit of celebration. I just wanted to recognize the results of first it was the Iowa HIIN, and now it's the Compass HIIN. But when we started this thing, well, I'm just going to focus on the bottom part on you guys, which is the HIIN progress. This is remarkable to me. When you look at where we were in 2016 and compare it with our progress today, you can see, you can read this slide as well as I can, but with regard to events avoided, we've avoided almost over 13,500 events. We generated over 177 million in avoided costs for the system. And most importantly, how does it affect our patients? Well, there are over 40,000 days that someone didn't have to lay in a hospital bed, and there are 254 people that are walking around today that wouldn't have been without the interventions that you brought to our patients. So congratulations, great work. I'm proud of this network, and I think most people know, or at least you should know, Compass HIIN is a good HIIN. Recently, we've been recognized with regard to some of our numbers. Our RAISE score was 4th out of 16 HIINs, so we're performing at a high level. We're among the top performers, and actually some of your innovations, because of your innovations, we've been asked by CMS to present on some national calls to kind of show the rest of the network how to do it. So great work, everybody, and now we're going to begin to move forward. So that's nice. What does that mean? What does moving forward mean? And I know that there have been a lot of questions in the environment right now. Some of your CWIN QIOs are telling you that they're going to suspend work at this time until further funding. There's a lot of stuff going on, and so I wanted to kind of give you, first of all, a look forward with what we know and what we suspect, and then kind of a commitment for how we're going to move forward together. First of all, I want to remind everybody that CMS has granted the option period for this HIIN program, so we will be working together through March of 2020 on this project. But it's evident now that CMS is going to be working on the next chapter of this as well. Now, I want to spend a moment and just tell you that CMS is changing all of the rules with regard to how they do contracting. The Iowa Healthcare Collaborative got the HIIN 1 contract, and then we were working directly with the Innovation Center, and then we got the HIIN 2 contract, and then we worked directly with CMS on the HIIN program. CMS has decided now to change the way they are going to distribute these contracts. And historically, in the past, there was only the QIOs that were doing this work, and then we had the HIINs and the HINs and others start to do stuff. CMS decided we need to create a new category of contractors with CMS. Organizations that have been vetted ahead of time, they have the processes, they have the financial measurement and the information technology basis to be able to do work, and frankly not embarrass us, CMS. So they were looking for a pre-vetted group of organizations, and they established that this year. You had to apply to be in this, and they call this group National quality improvement and innovation contractors. There are 58 organizations that have applied for that, or that have been approved for that, and IHC is one of those. What CMS is doing as we transition through 2019 is they're moving from this past contracting model into the future contracting model, working with the NQICs, National Quality Improvement and Innovation Contractors. The reason this is important is CMS wants to get more bang for their buck. So what they're doing is when they have a task order, when they have a piece of work that they want to do, they will write it all out, and then they will toss it in the cage of all the NQICs and let them compete for the privilege of doing the work. So it sort of looks like this. This is actually a CMS slide. You'll notice there's a stack of those NQICs in the middle, and those are organizations that have been pre-vetted. I guess there's 59 now that are eligible to apply for this work. And you can see in the top kind of ring there, those are different functions that CMS can bring to facilitate the contractors, but these contractors will be ones that will commit and compete for a contract with CMS to do this work. Then what CMS will do, as I said before, they'll toss something into the cage and let the NQIC folks compete for it. Those things are task orders, and there have been 2 task orders released to date. Task order 1 was for the QIIN QIO work. The current task order out is for outpatient physician work, or the CQIC application. Note that there is on the CMS slide a 3rd task order for hospital improvement and innovation focused work. So CMS has told us that there will be more work coming down the road, and we don't know much about it yet, but we know enough that we think we can give you a few pieces. So take-home points here, number 1, you're in the HIIN contract, which is going until March 2020. So we've already got work that we're doing, but know that, and then point number 2 would be CMS will go forward with a new task order. It may be released as early as this fall for organizations to apply for it. So we definitely will have an opportunity to continue to work together to move forward. What will that work look like in the next task order? So assuming that it will start sometime after March of 2020, what will it focus on? Well, we know that what CMS has done for this next 5-year period, called a scope of work, they have focused on some very specific achievable pieces. And we have been told that the hospital work in the future will focus on these 3 pieces. So we know that the hospital work will continue to focus on behavioral health outcomes, specifically also focusing on decreasing opioid misuse. Obviously, the next 2 are near and dear to our hearts in the HIIN world, which are improving patient safety and improving quality in care transitions or care coordination. So this has been the staple of the HIIN program from the beginning. Those areas where we can decrease unintended consequences of hospital care, and then ways that we can improve care transitions as we go from inpatient to outpatient or inpatient to long-term care, or with our pharmacy or whatever. How do we improve the way we move the healthcare? So with that, I think it's important for you to kind of know where we are. I know the QIIN QIOs currently are contracting their services because their contract is transitioning at this point. And I think you may remember from that slide where it had the HIIN 1.0, HIIN 2.0, and HIIN. Each one of those were contract transitions that we had to negotiate as well. I will make the commitment to you, the way we do it at IHC, just because a contract is coming to an end, we don't stop the work. When our HIIN 1.0 ended, we didn't even know that if there would be a HIIN 2.0, but we told our hospitals, we will not leave you high and dry. Keep reporting your monthly data because we think this is going to keep going. So just keep moving. Just because the funding stream is in question doesn't mean that the work stops. We did that between HIIN 1.0 and HIIN 2.0. We did that between HIIN 2.0 and the HIIN, and we will be doing that now as well. If there is an interim period between the current HIIN and the next task order, I will tell you, we will still have our staff here working with you to improve the care of our hospital patients. So that's a commitment we have for you. So, and we're looking forward with excitement to what we think is going to come out in this next task order. We will be moving forward together, and I certainly hope you come along with us in that journey. So the last slide I want to talk on is here before we go to questions, but it's just to kind of underscore some of the commitments we're making to you. Number one, you've been making improvements. We want to sustain the improvements we've made throughout the HIIN and the HIIN programs to date. So we're constantly sharpening the saw. We're constantly trying to have the rising tide raises all boats. We're raising the standard of care. That's our commitment. I know it's your commitment too, and our job is to help to sustain that improvement. Number two, CMS is going to continue to come out with new aims and new focuses, and we will continue to follow their leadership. We're going to work to align with the work that they give us opportunities to present with. So we're going to continue to work with CMS. We know that we want to continue to support you as you are doing patient safety and improving the quality to help you achieve the goals that you are building. I mean, this is really all about continuing to raise the standard of care. So setting new goals and moving forward. We want to leverage the data that you're already putting into the system so that we can use it to actually drive improvement. So providing meaningful information direct, we want to do that. We want to prioritize and inform local improvement efforts as much as possible. How can we take your data and use it to be effective? And finally, we have a commitment to partner with you. It says here, partner with you as we transition to the next cycle of work. Yeah, we're gonna partner with you as we navigate from the HIIN and to the next thing. But probably more importantly, we're partnering with you as you work to deploy improvement strategies with your own facility. You've got a unique environment. You have a unique payer mix. You have a unique provider mix. And everyone on this phone, everyone on this call has their own special thing. So we like to try to customize wherever we can and help you be the best that you can be. So with that, I apologize because I know I've just blasted you with a fire hose here. So what I'm going to do is I'm going to step back and let Kate kind of navigate the questions, and I'll respond to what you guys have for me. Thanks a lot.
Excellent. Thank you, Dr. Evans. So I'm looking into the chat and going backwards to see if anybody's entered a question in that we need to address. If you've not had the opportunity to do that yet, go ahead and open the chat box and enter any questions you'd like us to answer. We'll pause just a moment to allow you a little bit of time. As we had mentioned at the beginning of the session, if you weren't on with us from the start, this session has been recorded and will be transcribed. We'll be sending out slides to all registered attendees following the session today, and this session will also be posted to HIINnovation if you'd like to share it with other members of your team. As we wait for questions to flow in through the chat, I just want to remind you that your clinical quality consultant is available as well for additional questions that you may think of after the conclusion of today's call, and we really encourage you to reach out to them directly. Well, Tom, not seeing any questions flowing through the chat. Any closing remarks as we wrap up today's call? Well,
only the comment that I've never done such a good job that nobody had any questions. So I just would encourage folks, if you think of something afterwards, please send it to Kate, and we'll certainly work to address that. Just a comment though that we're in this together. Things are going to continue to move forward. We are living in an interesting time of healthcare transformation, and it's a privilege to work with you as we go forward.
Thank you all so very much. Have a great afternoon. Thank you for joining us.